Hello friends, I am Dr. Atul Patil, Cardiologist. Today we'll talk about a very simple test which is called as a cardiac stress test or treadmill test. You might have heard this word very oftenly when you visit your cardiologist or physician that you need to undergo a treadmill test. So in this video, we'll try to understand what is the procedure of treadmill test, who should get it done, and how to conclude the results of the test. So I'll start with the procedure. The treadmill test or cardiac stress test, as name indicate, is a test when you put your heart to the stress of walking or running. In this test, we ask the patient to run on the treadmill for around 9 to 10 minutes. We attach ECG leads to the chest of the patient and we monitor whether there are any changes in the ECG. And according to that, doctor conclude whether the test is positive or negative. Let us see who should get the test done. Usually when you visit your cardiologist and if you are complaining of chest pain and your ECG is showing minor changes, at that time doctor usually asks you to get your treadmill test done. In this test, we ask patient to run on the treadmill for 9 to 10 minutes and observe his symptoms, whether he is developing chest pain, shortness of breath, or there are any changes in the ECG. With the help of this test, we can really differentiate whether this pain is originating from the heart or it is a muscular pain or related to any other system. The other important condition where stress test is done is during routine health checkups. Nowadays, as you know, India is the capital of diabetes and hypertension. So anybody who is above 40 need to check whether his heart is pumping normally and whether it is functioning normally or not. In such patients, we usually routinely ask to get their treadmill test done so we can assess their functionality and blood supply to the heart. And sometimes patients above 60 years, when they are undergoing major surgeries like hip replacement or spine surgeries, the pre-anesthetic fitness is very important because we need to see whether the patient will be able to take the tension or stress of the surgery well or not. In such patients also, we do stress tests to see fitness of the heart for such procedures. So friends, when these tests are done, doctor usually tells you that your test is positive or negative. So let us see what is positive and what is negative. The sensitivity of this test for detecting heart blockages is around 75 to 80%. When there are ECG changes at the peak of the exercise, doctor usually says your stress test is positive. It means there are chances that the blood supply to the particular part of the heart is reduced, and in such cases, doctor usually advise you to undergo angiography. But if your stress test is negative, it means that your heart is working very well and there are very less chances that there are blockages in the heart. So friends, this is all about CST. So whenever doctors ask you to undergo CST, so please undergo this simple and inexpensive test to know your heart status. Thank you. Take care.